Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as valproic acid. Its brand name is Depakine. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We're going to start by talking about how valproic acid works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe valproic acid. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does valproic acid work? Well, valproic acid is a carboxylic acid and anti-epileptic agent. Its activity is thought to be related to the elevated concentration of GABA in the brain. GABA would be an inhibitory neurotransmitter. Now, in terms of indications or reasons we would prescribe this medication to a patient, we often see it used in bipolar I disorder. It can be used to treat simple and complex absence seizures. Medication can be used for migraine prophylaxis, as well as in complex partial epileptic seizures. Now, with respect to contraindications or reasons we would not be able to prescribe valproic acid, we wouldn't be able to give it to a patient who had a hypersensitivity to valproic acid or to any other component of the formulation. We also wouldn't see it used in pregnancy or in patients who have hepatic disease, as well as in patients who have urea cycle disorders. Now, what about dosing with valproic acid? So, an off-label dosing for migraine prophylaxis would be 800 milligrams per day or 1,000 to 1,500 milligrams daily to maintain plasma concentrations above 50 milligrams per liter. In the treatment of an absence seizure, the initial dose may be 15 milligrams per kilogram per day, and this would be given in 2 to 3 divided doses if the daily amount is greater than 250 milligrams. For maintenance, we may increase the dose by 5 to 10 milligrams per kilogram per day orally at 1-week intervals until seizures are under control and the patient is tolerating the medication still. The maximum dose would be 60 milligrams per kilogram per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using valproic acid, so I'll go over some of those here now. 6 to 24% of patients may experience alopecia, while 3 to 8% may experience peripheral edema. A rash may occur in 6% of patients, and as well as 6% of patients may experience an increased appetite. Weight gain may happen 4 to 47% of the time, and abdominal pain may happen 9 to 23% of the time. 5% of patients may experience constipation, and 12 to 23% may experience diarrhea. 8 to 13 may experience indigestion, and some patients may experience a loss of appetite as well. 4 to 12% of patients may experience this. 22 to 48% of patients may experience nausea, and vomiting comes in between 11 and 27%. 8% of patients may experience a backache, and some patients may also experience blurred vision. Depression seems to happen 4 to 5% of the time, and nervousness 7 to 11% of the time. 2% of patients may experience a fever. That's all we're going to talk about today with valproic acid or Depakine. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found this information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.